This is a Jet 24, Fox 66, your Erie.com special report.
Good afternoon, and thank you for joining us as we give you an update on COVID-19 here in Erie County. Today, Erie County reports 127 new cases of COVID-19 and, sadly, 2 additional deaths. Our daily case count is now averaging over 100, and for the month of September through this month, where we are in October, we've averaged almost 1 death every day. I'm truly concerned about the potential for exponential growth in cases as activities move indoors. We've had really a fortunate fall here that's been relatively mild so far, but we all know that the Erie County weather will change quickly. I urge everyone to be cautious as activities move indoors. It's important, while gathering indoors with others from outside your household, to use every layer of protection available to you. This includes social distancing, wearing masks, and most importantly, for those who can, to get vaccinated. And for those who qualify, get your booster. I'd also like to add that it's important this year, particularly, to get your flu shot. These layers of protection are our best line of defense to keep ourselves, our loved ones, our neighbor, and our community healthy. This also reduces the burden on our healthcare systems, which we understand are becoming more and more overwhelmed with staff issues. Currently, only 51% of Erie County residents are fully vaccinated. The COVID-19 vaccination by zip code population was just updated at eriecountypa.gov, and you can find that information by visiting our website. Of note, we have 3 zip codes now in Erie County that have reached over 60% of their residents being fully vaccinated. That's great. Unfortunately, we also have 5 zip codes that are still under 40% being vaccinated, and of course, that is really concerning. The other interesting piece of data available on our website is the vaccination.
Turn off your head.
The other interesting piece of data available in our website is vaccination by age. Astonishingly, those in their 70s have reached over 90% fully vaccinated. So 70-year-olds, thank you. Congratulations on getting to that number. However, this number, the percentage of those vaccinated within that 10 years of age groups, drastically drops to the younger age groups, where only 50% of people who are in their 20s are fully vaccinated. And this is really unfortunate because while this group may not experience the most severe effects of COVID-19, they are still at risk for long-term complications, which people are referring to as long COVID, as well as, and I think one of the biggest concerns, spreading it to people that they love. So I implore everyone to get vaccinated. Again, if not for yourself, do it for the people that you care about. Do it for your friends. Do it for your family. Do it for your neighbors. Do it for the children who are under 12 who absolutely cannot get vaccinated yet, or for those who are in an immunocompromised situation and can't get vaccinated. Today, I'm pleased to be joined by 2 people who are with me often. First, Dr. Howard NADWORNY. Dr. NADWORNY is the infectious disease physician who has consulted with the Erie County Department of Health since the beginning of this pandemic. So, Dr. NADWORNY.
Good afternoon. I just wanted to say a few words focusing on 2 issues. One is the fact that we are seeing more younger people getting severe COVID, and the other regarding the effect that it's having on the healthcare system. What is happening in the hospitals is that not only are the number of cases rising, but the volume of other people sick enough to be in the hospital is also very high. And when COVID patients fill a large number of hospital beds, that makes fewer beds available for other people with critical illness, and it makes all of the staff in the hospital work much harder. So many more healthcare workers are burning out because of the intensity of the work that filling 40 or 50 beds in a hospital with COVID will tend to do. Even though it's still not the majority of hospital beds, the intensity of care has really thrown off the ability of us to care for all the others. The other point that I would make is that as we see COVID infecting more young people, we are also finding in those people where we are able to establish who gave COVID to an elderly person, that in the majority of cases, it's a younger person. Often it's a family member or it's an acquaintance, but the spread to the seniors who end up hospitalized and quite ill is mostly from younger people. So even though younger people may be at much less risk of severe illness, they are quite contagious, and they are the ones who are spreading the disease to older people. That's also the case for children, because although children do not become very ill from COVID, they live with adults, they live with grandparents, they have close contact with older people, and they very readily can spread the disease as well as adults can. Thank you.
Thank you, Dr. NADWORNY. It's always good to have you on, and Dr. NADWORNY will be available for questions from the media. But before that, I'd like to bring on Director LYON, the Director of the Erie County Department of Health. Melissa?
Thank you, County Executive. It's always a pleasure to join you on the press conference. I want to talk today to our audience about the importance of vaccines and their protection from COVID-19 infection, serious disease, hospitalization, and death. We are now in the last quarter of 2022, and we are on our second year of responding to the COVID-19 pandemic. And as the weather turns colder, we will be spending more time indoors, which will affect the way we will be dealing with the COVID-19 in the coming days. So to provide a perspective for the residents of Erie County, I want to share some statistics from the entire Commonwealth of Pennsylvania. So this information is from the Pennsylvania Department of Health, and it's reviewing the first 9 months of 2021. From January 1st through October 4th of 2021, 91% of reported COVID-19 cases were in unvaccinated or not fully vaccinated people. That was a total of 771,734 cases. Only 9% were post-vaccination or breakthrough cases. So cases among the unvaccinated and not fully vaccinated was 5.6 times higher than the cases among someone that was fully vaccinated. 93% of reported hospitalizations with COVID-19 as the primary diagnosis or cause of admission were in unvaccinated or not fully vaccinated people. 93% of COVID-19 related deaths were in unvaccinated or not fully vaccinated people. It was a total of 7,625 COVID-19 related deaths. Only 7% were post-vaccination. Death among the unvaccinated and not fully vaccinated was 6 times higher than the death among the fully vaccinated. To add even more perspective, outside of Pennsylvania, this data is consistent with national trends, and it's similar to the data that was reviewed by the FDA and CDC. And this is the rationale for the recommendation of a booster dose for vulnerable populations following the completion of their primary vaccine series. So it's a reminder that it's recommended for those that are 65 and older, those that are 18 or older and are residents in long-term care settings, those that are 18 or older with underlying medical conditions as described by the CDC's clinical guidance in accordance with the CDC's recommendations, or 18 years and older with increased risk of getting COVID disease due to their occupation or institutional exposure, such as frontline essential workers, healthcare workers, as described and in accordance with the CDC's recommendations. So to summarize, it is very, very, very unfortunate. The large majority of positive cases, hospitalizations, and sadly death are among our friends and loved ones who are unvaccinated. Just like the diseases that can be prevented, such as polio, chickenpox, and measles, which we rarely hear about or see anymore because vaccines work. COVID-19 is also preventable with vaccines. I urge you, if you're not vaccinated, to please do consider getting vaccinated. If you have concerns or hesitancy, please talk to someone that you trust and get information that can help you make the right decision. Thank you, County Executive. Back to you.
Thank you, Director Lyon, and thank you and all of your staff at the Erie County Department of Public Health for the great work, the long enduring work that you have been doing during this pandemic in terms of helping to keep Erie County safe. So before I turn over to the media for questions, I would like to share that there will be a flu and COVID-19 vaccine clinic during the Latino and Hispanic Heritage Festival, which is coming up this weekend, October 16th, running from 10 a.m. to 4 p.m., located at the Boys and Girls Club on East 6th Street within the city of Erie. And now I'd like to turn it over to the media, and we will start today with Talk Erie with Joel.
Thank you, County Executive. I appreciate that. I have a question for Dr. NADWORNY. Dr. NADWORNY, we're starting to see some national reporting that is calling into question masking strategies when it comes to the Delta variant. What are you seeing?
I am seeing that masking is highly effective as long as the mask is either a surgical mask, an N95, or a cloth mask that has several layers and fits snugly over the nose and chin. So I'm not sure what you're referring to, because although the medical masks are felt to have a higher efficiency, it's not that cloth masks don't work, it's that they are less good. But they are still remarkably better than not wearing a mask. So I'm not sure what you're referring to, but I haven't seen anything indicating that wearing a multi-layer mask that fits well doesn't work.
Just to follow up, it's more of a macro reporting of seeming that high masking areas have the same level of COVID as some of the low masking areas in the United States is what I'm indicating.
Well, the problem with those kind of studies is high masking areas include a lot of people who aren't wearing masks. So it doesn't actually determine that the people wearing masks are the ones getting infected. But one of the problems with masks is that they work best if everyone is masked. So if some people inside are unmasked and they have COVID, their ability to spread the virus can still overcome the protection of masks in the other people. So part of the problem is that because enough people are not wearing masks, it makes it harder for those who wear masks to be protected. It does reduce the risk, but not as much as if everyone did. So I don't know whether those studies really mean anything.
Thank you.
Thank you. We'll go to Erie News now.
Hi, good afternoon. A question for Director Lyon. Director, do we have data over the last month or so in terms of percentage of cases that are breakthroughs? I know the state had said it's seen roughly 25% or so of hospitalizations and cases now over the last month are breakthroughs. Are we seeing something similar in Erie County?
Yeah, let me get, so we have actually September's numbers breakthrough available, and about 5.3% of our cases in Erie County have been breakthrough. It's about 160 out of 300 or 3,033, and that was September's data.
Okay, so that's just over the last, basically the last month, the month of September, 5% of cases were breakthroughs?
That's correct.
Thanks.
Okay, we'll go on to Jet TV.
Thanks, County Executive Scott Bremner. I'd like to ask this question of Director Lyon, perhaps. We still continue to hear people who simply do not believe the numbers. They believe that for whatever reason, to serve whatever purpose, that the numbers are inflated, or people who have underlying conditions that get ill, that gets listed as a COVID death or a COVID sickness. How would you assess the means by which we figure out how many people are actually sick, and do you believe that it is accurate within whatever statistical margin of error makes sense for these kinds of studies?
Thank you kindly for the question. Yeah, I would believe that you're hearing information that people don't believe it. And what I can tell you about case identification is it's very rigorous and it is supported with clinical data. So for example, if you have cases that are reported on a daily basis that you get from Erie County, they have a PCR test. Primarily, they have a PCR test, which is the gold standard for COVID-19 diagnosis. We also have the option to accept antigen tests, which demonstrates active case of COVID as well. A probable case, which we have a few thousand probable cases, that indicates that they have been in close contact, that someone is positive, and then they have the typical clinical symptomology that would say that they have COVID-19. And why you end up classifying them as probable is so that you don't have to send them out into the community then to get a test, because you have high suspicion that they are positive with COVID-19. So I'm very confident in the process that's used. We have it's the clinical epidemiology team throughout the state and the country that set these definitions. So I have high confidence in that. What I can tell you is I actually believe that the numbers that we report are probably lower than the actual infections that we're seeing in our community. That would be due to the concept of individuals not going and getting testing, maybe thinking that they have just some mild symptoms of something else, maybe not wanting to be identified as COVID-19 positive. And then we have those that are asymptomatic that never even demonstrate any signs or symptoms that would be clinically diagnosable. So all said and done, the numbers are very real. The numbers I trust very much. And if anything, there are probably more cases in the community than we're reporting. I would like for Dr. NADWORNY, if he doesn't mind, to talk about how in the hospitals, when they're identified and admitted with COVID-19, because I think he has better insight on that than I do. Thank you kindly for the question.
Well, all of the people admitted to the hospital with a possible diagnosis of COVID, they have pneumonia, they have blood clots, they have unusual nausea and vomiting, they're acutely ill, all of them get tested for COVID with a PCR, which is highly sensitive and very specific. So it doesn't turn positive in other diseases. And I will tell you that everyone who is ill with a diagnosis of COVID has pneumonia. Many of them have blood clots. They all have high inflammatory markers of disease. And I would say that there are no patients who are diagnosed with COVID or COVID pneumonia, who become sicker, who die, who are incorrectly diagnosed. We know that it's really important to try to get diagnoses correct. We do see people who have COVID, but are primarily in the hospital for other things. And actually, those people tend not to be as sick. But the people who come in with COVID pneumonia are diagnosed with the test. Their inflammatory markers are very elevated, clearly have very characteristic illness. So I think that those people who don't believe it are people who really have not bothered to look, but I think they are quite incorrect. This is a disease that we have not seen before the beginning of 2020. It is common. People get severely ill. We've not seen people before this get severely ill with this kind of presentation. So there is no question in our minds that all of these people have SARS-CoV-2 infection. Thank you.
Thank you. And now we'll turn to David Bruce from the Erie Times News.
Hi, Kathy, it's David. A question for you. I talked with Melissa yesterday a little bit about the plans for county health officials to talk with event organizers in Erie County about what kind of masking and vaccine policies will be held as more and more events are going inside. Are you giving more thought to any kind of countywide mandate for either masking or for vaccines for indoor events?
So what we are hoping to do is to work with those event organizers and have the event, the venue, the organizers do what we know is the best thing to do, and that would be universal masking. Vaccine requirements are happening in many places across the nation, as are masking requirements. The most, I think, the facilities that do that are the ones that we feel obviously are the most comfortable places for most of us to go. So we continue to have those kind of discussions. At this point, not looking to do that in terms of Erie County specifically having a mandate on that, but I'm not ruling it out either. But we really hope that it's voluntary, that these facilities decide to do it on their own.
How confident are you that some will do this voluntarily? Have you gotten any kind of feedback at this point?
The feedback has been very limited so far, but we are, having those discussions, and we will continue to have those, and we'll see where things go. I mean, we can all see the numbers. COVID is alive and well, as you know, and everyone watching and listening today knows. It is alive and well, and always trying to find its next host out there. With almost one death a day, this is a really dangerous situations for us to be in as we go into the colder weather months and more people going inside. So all of these venues could be very, very much of an assistance to the health department, to all of our health systems in trying to keep those numbers down. If they implemented this, it's not to say that we can't do it here in Erie County, but it's obviously much more difficult if it's not done on a statewide level, and I don't see that happening because of some of the restraints put on the governor by the legislature. So again, not to say that we will rule it out, but we're really looking for cooperation. Thank you.
Thank you.
I'm going to go back to Joel with Talk Erie.
Thank you, County Executive. Here's a question for Melissa Lyon. Melissa, the latest COVID-19 early warning monitoring system dashboard shows that out of the 1,268 new cases in Pennsylvania, Erie County had 184, which is 14% of the new cases last week, even though our population in the county is just 2.5%. Is this causing the health department to rethink your messaging and outreach strategies to get better outcomes?
Joel, I'm really glad that you brought up the statistics. As the county executive has mentioned, COVID virus is very much here in Erie County. Most of my calls over the last few days have been desperate in discussing the cases, what's happening in our hospitals, the number of deaths we're seeing, the age groups that are impacted 0 to 19, those that are being hospitalized age group. It's a real issue. We are actually in a really bad spot, and we're going into the cold months, and I'm very concerned that it's going to get worse. I hope I'm wrong. I really do. But there's nothing that would be a predictor that I'm wrong as I sit here and talk to you today. With that being said, I don't know what additional message, Joel, that I could be delivering that would make people change their behaviors in wanting to wear masks if they're already not wanting to, or if they're wanting to not get a vaccine. I'm not sure what the message is. I feel a little bit, I've run out of messages. So I'm here today to have you help me get the message out that we're facing a lot of COVID disease right now in our community. And as I said earlier, the numbers that are reported today, there's more numbers out there that we don't know about. So it's serious. I don't have anything else to add. Thanks, Joel.
Thank you, ma'am.
Thank you. And now we'll go back to Erie News Now to Ethan.
Hi, a question for Dr. NADWORNY. Doctor, what are you seeing and hearing from hospital staff in terms of just how dire the situation is in our local hospitals, both with A, finding beds, and then B, finding enough staff to cover patients who need an awful lot of care?
There is great frustration in the hospital because they're being stretched very thin. They are having staffing issues. And because almost all of the severe COVID patients they're taking care of are unvaccinated, they're very frustrated because most of those cases would have been preventable. And that would have freed them up to be able to take care of the other critically ill people who are also filling the hospital. You have to realize that in hospitals that are designed to take care of patients efficiently and are staffed for, say, 250 beds, if you fill up 40 or 50 beds with COVID patients, then there's that many fewer beds to put the other critically ill people in. There's no overflow. And in fact, you start getting a crunch of beds. And that means that everyone coming in the hospital tends to be that much sicker. So the staff is very frustrated, and many of them are getting really tired of having to do this sort of crisis level care for as long as they have. For example, I think right now the odds are high that if you went into a hospital in Northwest Pennsylvania, say a small hospital, and you had a more severe illness that would require you to be transferred to, say, St. Vincent or Hammett, you might have a great deal of difficulty getting transferred because there's a shortage of beds and staff to take care of them because of COVID. So it is cascading across a lot of other conditions. Is that helpful?
Yes, sir. And just on a personal note, how frustrated are you a year and a half now into this, and with widely available vaccines, that we are arguably worse off than we've been maybe ever?
You know, if 90% of the population was vaccinated, instead of having 70 people in the hospital, we probably have 14. That's the difference that vaccination would make. And what's ironic is that all those people who've gotten COVID who say, gee, that wasn't so bad, if COVID was a vaccine, it would be 10 to 1,000 times riskier than the vaccines we're using. And yet those people did okay. And the people who get vaccine do fine and are protected against severe illness. If COVID only caused a mild illness, even in vaccinated people, I don't think we would be that concerned. But enough people are getting severely ill because they're not vaccinated and require hospitalization that it's actually already overloading the whole system. So yes, it's frustrating because elsewhere in the world, they are getting vaccinated, they're wearing masks uniformly indoors, and their numbers are going down, and ours are not. And it's not rocket science. And so yes, it's very frustrating to me that we are somehow in America not recognizing that we want people to stay well and be healthy.
Thank you.
Thank you, Doctor.
And now we'll go to Jet TV. Scott.
All right, County Executive, I think this one is for you. The three of you together have painted, if not a grim picture, certainly a serious one that needs to be given a lot of attention. Can you tell us about the thought process that either you're going through or in your conversation with the governor's office, what they're going through statewide, in terms of when is it time to start ratcheting things up? When do we have to go back to 25% occupancy for businesses, and when do we have to, do those kinds of more severe measures that we went through the first time, that we understand the price of that, and so we're trying to avoid it, but when does the illness kind of overwhelm the ability to keep businesses going and so forth, and some of the things we'd like to try to do? And what is your thought process in terms of when we might have to take more severe measures to try to address this?
Well, Scott, I think one of the barometers, and probably the most important barometer that we've got to continue to keep our eye on, was just talked about by Dr. NADWORNY, and that's our hospital systems. We don't want to be in a situation that we've seen happen in other places across this country, where people who have a heart attack or some other catastrophic thing happen to them can't be taken care of in our hospitals because they're filled up with mostly unvaccinated individuals who could have prevented their hospitalization if they'd gotten the vaccine. So that's what we're really watching, is the healthcare systems, where they're at, and do we need to do something much more drastic because our hospital systems are becoming overwhelmed. Because the majority of people who are vaccinated are also the people wearing their masks. That's what's I think frustrating for us. You know, everyone should be wearing the mask when they're indoors. But what I find is most of the people wearing their masks when they're indoors are the vaccinated people. And it's the unvaccinated people who aren't wearing the mask and they're not vaccinated and they're putting themselves at risk. And then they're ending up in the hospital. And that, to me, it just makes no sense. It's extremely frustrating. So again, I think our barometer goes back to what's happening within our healthcare systems. Are they getting to a point where we have to take more drastic measures? Not so much even for the COVID patients coming in, but more so for the people who have something else happen to them, whether it be a heart attack or a serious accident or some other illness that comes upon them quickly and they need to be seen in a hospital setting. Thank you. We'll go back to David at Erie Times News.
Sure, Kathy, thank you. A follow-up on Scott's question. When you talk about more drastic measures, and Scott mentioned specifically a 25% occupancy perhaps at businesses, I know in the past you've said if there would need to be more drastic measures, it probably wouldn't be something like that. It would be more like mask mandates, large crowd gathering limits, things like that. Is that still accurate? I mean, you've said in the past it didn't seem that the spread was happening at individual businesses. Can you elaborate a little bit on that?
Right, and I think that you're right. You know, we would be looking at, you know, a more of a widespread mask mandate. Right now we have it in schools, and I will say our schools are doing a great job. We're not seeing a lot of spread of COVID-19 in the classrooms. Now we are seeing COVID-19 spreading amongst school children, but it's happening in things that happen outside of the classroom, whether it be their sports activities, whether it be sleepovers, you know, all of the things that children, of course, love to do, and they're not wearing masks, unfortunately, sometimes, and COVID-19 spreads amongst those children, who then, of course, take it home to their family members and the people that are more vulnerable in their lives, including maybe their grandparents. So we're seeing success in schools with wearing masks. So we could be going to a mask mandate for our businesses, for example, indoor activities like that. And that would probably be one of the things we would try before we would do anything more drastic. I really do not believe we will go to capacity issues in just most regular businesses. We'll let them determine what that is for themselves, but we could go towards the mask mandate.
And what's the biggest concern about having a mask mandate for businesses? It would seem like, based on last year, it would be enforcement. Does that still hold true?
Enforcement is the big issue. You know, it's not something that county government normally does. I mean, we enforce on the food end of things, of course, through the health department and our health inspections. But the enforcement for businesses becomes a challenge. Some businesses will be much more cooperative than others. You know, with the school systems, we've actually had very, very good compliance, very few issues with enforcement. But with the businesses, we're just talking about a much, much larger task.
Thank you.
Sure. And we'll go back for a final question from Joel.
Yes, thank you, County Executive. One more question for Dr. NADWORNY. Doctor, just can you unpack again where we're at with boosters? Is it 6 months? Is it 8 months? Is it only Pfizer? Can you just kind of go through the basics with us?
Right now, it is just Pfizer because there's the most data on Pfizer, and recommendations are for booster doses for people over 65, are immunocompromised, or have high-risk conditions. For other people, the booster dose is acceptable, but not a priority. That is not yet the case with Moderna. It may yet be. I suspect it will become the case with Johnson & Johnson, because that seems to be the relatively least effective of the vaccines. But part of the problem with the vaccine boosters is that the difference between being unvaccinated and having a 2-dose series is so dramatically greater than the difference between getting 2 doses and getting 3 doses. that we don't want to lose track of the fact that the issue isn't so much whether someone who has had 2 doses should get 3. What we really need to do is get people who've had 0 to get 2. And so the boosters do clearly reduce your risk of getting COVID going forward and your risk of severe illness, but it's actually fairly low to begin with, and it goes even lower compared to those who aren't vaccinated. So I have found that the people who've been vaccinated often want a 3rd dose because they really want to be as protected as they can be. And a lot of that is because they know that there's a large crowd out there who's not vaccinated at all, and that's who the vaccinated people are worried about. So if we could, in fact, increase our vaccination rates among the unvaccinated, the 3rd dose, the booster dose, might not be as critical. So I think that that's going to evolve with time. It's mostly because of the current situation of relatively small numbers of vaccinated people overall.
Thanks for that clarification. Appreciate it.
Thank you. And now we'll go to Ethan at Erie News Now.
Thanks. County Executive, I'll pose this question to you, but if it can be better handled by Director Lyon, feel free to pass it over to her. Is there a specific benchmark that you're looking at? That you're saying if the situation gets to X point, we need to do more, we need to do something like impose a universal mask mandate?
So I'm going to turn this over to Director Lyon. She has conversations on a weekly basis with our hospital and healthcare partners, and Dr. Nadworny might want to also weigh in. Melissa?
Thanks for the question, Ethan. I can't tell you that I have a benchmark that I'm looking at right now. However, I think it's probably past time to take a look at what that could mean. Was really hopeful that we wouldn't be looking at these numbers consistently for as long as we have, but now that we are, it definitely may require that. I have communication with the hospital system leadership regularly. I look to them for guidance if they are needing additional assistance for what we do as a community. So the short answer is I don't have a benchmark that we're looking at right now, but I can tell you that virus is definitely present in Erie County and thriving. So thanks, Ethan.
Director, 1 to 10, 10 being extreme, where's your level of concern right now?
Pretty high. I love your 1 to 10s, Ethan. I'm gonna rank it around 8.5 or 9.
Thanks.
Thank you, Ethan. And now we'll go back to Scott at Jet TV. Do you have a final question, Scott? Maybe we lost Jet TV. I'm not sure. So we'll end up with David, Erie Times News. Do you have a final question?
Yes, Kathy. This one's for Dr. Nadworny. Dr. Nadworny, what's the latest in terms of research and what you've seen at St. Vincent about the effectiveness of natural immunity? That the folks that had COVID, say during the first surge or sometime in 2020, how much protection are they seeing during this surge, and how does it compare to vaccine immunity?
David, I don't know that anyone has systematically looked at that in Erie County. It's difficult to be able to know because what we don't know is, for example, if someone's had COVID before, are they less likely if they get a cold-like illness to get tested, or are they more likely to say, oh, I had COVID, I probably don't have it again? So they may be underrepresented in the testing. In terms of hospitalized patients, I don't have the answer to that, although I suspect it's very low, probably in the same range as people who are vaccinated, but I don't know that there's been a study. We know that previous infection gives you good protection against getting reinfected. And in fact, that's why for many people, we've recommended getting a single booster dose of vaccine, because the data shows that those people have the greatest protection against variants as well as the highest level of antibodies. So I suspect that we are not seeing very many people who've previously had COVID, but because it's only people who were tested, we don't really know if someone coming in with COVID who might have had it a year before but didn't get tested is getting reinfected. So we just don't have that data because we have no systematic way of looking.
All right. Thank you much.
Okay, thank you, David, and thank you all for your questions today. Before I close, I'd like to offer an update on the Erie County Rental Assistance Program. As a reminder, this program is run through Erie County Care Management and can help those struggling to pay their rent or their utilities. To date, $14.5 million have been dispersed for rent and utility assistance, which has helped 3,123 families in Erie County. Help is still available with over $8 million left in the fund, and we expect that we may get another allocation. So if you or someone you know needs assistance with rent or utilities, please contact Erie County Care Management to see if you are eligible for that program. And then one last highlight, I'd like to mention a star business, and that's Footlights Theater Performing Arts Center, and a locally owned business which just opened its doors at their brand new facility this week. They're working to keep their students as safe as possible by offering small class sizes which allow for distancing, requiring all students and staff to wear masks, and they're spacing classes to allow for sanitation between classes. They have made a virtual option available for students, and best of all, their staff is 100% vaccinated. So way to go, Footlights. Thank you for being that shining star of a business trying to help control this pandemic in our community. In closing, I just ask that you all do whatever you can to try to keep yourselves, keep your loved ones, keep this community safe. And we need you to do that by wearing a mask when you go inside of any building with people that you don't live with, and secondly, if you're not vaccinated, to get that vaccine. Vaccines are free. They're very available. You can go on vaccine.gov and find locations throughout Erie County. You can also go on our website, eriecountypa.gov. With that, please stay safe, and we'll see you back in 2 weeks. Thank you.